So this video, we're going to talk about how to describe a rash. Why is this important to know? Well, we want to have the right description when we're talking to each other, and also the classification helps us decide what differential diagnosis there is. There are four main ways to describe a rash. Is it flat? Is it raised? Is it filled with fluid? Is it purple? Or by sizes? Let's go through them. First, a flat rash. A flat rash is the kind that you can see, but if you run your hands over it, you can't feel the difference. The flat rash can be classified by sizes. A macule is a flat rash that's less than 1 centimeter. If it is a flat rash that is more than 1 centimeter, it is called a patch. This is also an example of a patch. The second type is the rash that you can feel when you put your hands over it. So something like this. They're also classified by two different sizes. A papule is anything that's less than 1 centimeter in diameter. Anything bigger is called a plaque. In this patient, you can see that there are multiple sizes of both papule, the smaller kind, and plaques, the bigger kind. The third kind is the kind of rash that has fluid inside them, such as this one. If the fluid is clear and the rash is less than 1 centimeter in diameter, these are called vesicles. If they are filled with pus or white blood cell, they are called pustules. If this is more than 1 centimeter, these are called bullae. The last kind are the kind of rash that are almost purple in color. They're purple because they come from blood leaking into the skin or mucous membrane. They're called purpura. By definition, they are non-blanchable. That is, if you put pressure on this rash, it does not change color or become paler. They're divided into two types, either flat purpura, the kind that you cannot feel, or palpable purpura. This is an example of a flat purpura. You can't feel them. The small ones are called petechiae, and the bigger ones are called ecchymoses. And these are palpable purpura that you will be able to feel if you run your hands along the legs of this patient. So hopefully this gives you an idea how to describe a rash. We talked about how the flat lesions are called macule or patch, raised lesions are called papule or plaque, fluid-filled lesions are either vesicles, pustules, or bullae, and the purple ones are either flat or palpable purpura. Hopefully this is helpful for you. Thank you for watching.